Thank you so much for asking your questions, and then I try to respond to them in the Ask Me segment. You have asked about bipolar disorder. Bipolar disorder is a mental illness that causes dramatic shifts in a person's mood, so it's considered a mood disorder. The energy and the ability to think clearly goes away. And people with bipolar experiences high and low mood, known as mania or hypomania, and then depression, which differs from a typical ups and downs of most daily aspects of that people experience. The average of onset is about 25, but it can also occur in teens or more commonly in childhood. The condition affects men and women equally, with about 2.8% of the US population diagnosed with bipolar disorder, and nearly 83% of that cases are classified as severe. If it is left untreated, bipolar disorder usually worsens. However, with a good treatment plan, including psychotherapy, medication, and a healthy lifestyle, a regular schedule, and early identification of symptoms, most people live well with the condition and can be very functional. There are four types of bipolar. Bipolar 1, which has the mania, and then it has the depression. And if it's not treated, both the signs of the mania or the depression can create psychosis. Or you have bipolar 2, which you have hypomania, which just feels more like agitation and anger, and then deep depression. And then you have cyclothymia, which is not as severe, but it does have the cycles throughout the month or throughout the year. And then it's unspecified, which has its own characteristic, and sometimes it has the rapid cycling, which they call bipolar rapid cycling, which was within one day, you could go really up and down. The causality, as far as the research has shown at this point, is genetic. Another component is high level of stress and trauma, and then brain structure and function. Now, brain scans cannot diagnose bipolar disorder, yet researchers have identified subtle differences in the average size or activation of some brain structures in people with bipolar disorders. So what can help? Medication, such as mood stabilizers, antipsychotic medications, and to a lesser extent, antidepressants help, and you can get that from a psychiatrist. Psychotherapy works. Many of the cognitive behavioral, family focus, awareness integration theory, all of those help because sometimes the person needs to really monitor and find out exactly what the symptoms are, how it impacts them, and how they can manage those symptoms when the cycles come in, how to manage themselves. If there was a trauma or a stress in their life, how to manage the trauma and stress and heal themselves in a sense and manage themselves throughout their life, because this is a lifetime condition. Stress management strategies, which you could also get that through psychotherapy, like education and recognition of the episodes, early symptom, and calling the psychiatrist immediately as the symptoms should begin so that they don't go through all of the cycles. And then complementary health approaches are so important. Exercise, aerobic exercises, meditation, for some people, spirituality, and appropriate nutrition really supports to regulate the chemistry of someone who has bipolar beside their mood elevation and up and down. And usually if sleep patterns, eating patterns, and energy and exercise patterns are not handled appropriately, it can actually ignite some more stress and then therefore ignite another cycle. I hope that was useful for you.